Welcome back. Now, the world is grappling with a very deadly disease and rather virus, COVID-19, and this comes at a peculiar time as we also mark World TB Day, a disease that has been ravaging the world over back in the days where we had people dying by the thousands. So today we're going to try and draw comparison between tuberculosis, where we are at today in terms of treatment and prevention, as well as COVID-19, just to see how similar these conditions are and obviously what can be done and what we can pick from one way of dealing with it and apply it to the other, perhaps in a way that would assist us to better take care of ourselves and, prevent it from being a more severe condition, as we are rather having more severe impact on the world, or rather Kenya right now. Now, joining me for that conversation, I'm having Dr. Chakaya Jeremiah, who's a chest physician and TB expert, as well as Dr. Bernard Lagat of AMREF Health Africa. Welcome. AMREF, rather, Health Africa. Welcome to the show, gents.
Thank you.
Now, when we look at tuberculosis, this has been marked as a very severe condition, and the spread is quite wide and it goes rapidly, and we can draw comparison understandably with what we are facing today, which is COVID-19. I'd like to start with you. Could you define for us what tuberculosis is, and of course COVID-19, and how those two can be compared?
Thank you. Thank you. Tuberculosis is a disease primarily of the lung, although it can affect any part of the body. It's caused by a bacteria. This bacteria is called Mycobacterium tuberculosis.
Right.
And it was discovered many years ago, more than 100 years ago, by a German physiologist and a practitioner called Robert Koch. And he announced that discovery on March 24, 1881 or 82, thereabout.
Yeah.
And it's passed on from one person to another through inhalation. So it's, again, through breath, as it were.
Yes.
If you are coughing, if you are sneezing, if you laugh sometimes and you have this germ in your lungs, then you can spread it to those who are in contact with you. The COVID-19 is a different germ. This one is caused by a virus, and this is a very new virus. Initially, when it came into being, it was called nCoV, or new coronavirus.
Yes.
And then it was renamed. Scientifically, it is called SARS-CoV-2. And it's also spread from person to person through processes that involve breathing, laughing, and coughing, and sneezing, and things like that. So in essence, there are similarities between tuberculosis and TB, especially in terms of transmission, the organ that is most affected, and transmission patterns.
Okay, and over to you. He has pointed out that one is a bacterium and the other one is a virus-caused condition. Now, what does it being a virus, we're talking about COVID-19, make it more severe to TB, or is there, as far as spreading is concerned, does it make it faster, with being COVID-19 being a virus spread and the other one being a bacterium, or are they just similar in that way?
I think basically, for COVID-19, we are talking about the short onset, 2 to 14 days. But then tuberculosis is a slow onset. You get infected, sometimes you don't manifest the symptoms. It may come back after several years later on as a reactivation. So, and the COVID-19, especially if people who are elderly and with other conditions, can actually move from a mild to a very severe cases. While tuberculosis tends to be chronic, it builds over time, but it both causes damage to the lungs, and it causes death. Yes.
As far as we're looking, as we're drawing those comparisons, we find that in COVID-19 we've been told it's quite, severe on people who have pre-existing conditions and the elderly, as you have pointed out. Is this similar with tuberculosis?
Yeah, for tuberculosis, Basically, tuberculosis reactivation is a function of immunity, that if your immunity is compromised, then you tend to get what you call reactivation of the tuberculosis. And we see a lot of association of tuberculosis with HIV/AIDS, for example, that lowers immunity. You also see it with diabetes. We also see it with malnutrition. We also see it with cancer. And when there are these comorbidities, of course, then we see severity and sometimes fatalities associated with it. Yes.
But how long between the, getting it and death? Because with COVID-19, we've seen people dropping like flies. Would you say this is a similar case with TB?
No.
Yeah.
Tuberculosis is slow, and I think the bigger problem is about the delay.
Yes.
If you delay, then the complication sets in.
Okay.
Yes.
Now I'll go back to you, Dr. Jeremiah. Now, as we talk about COVID, or rather tuberculosis, there have been measures that we've put in place over the years since it was discovered by Dr. Koch, and now we know that there are measures to be taken, and then we are aware that if we do this, we can avoid getting it spreading from people, person to person. Could you mention some of the measures that we've taken, how we have learned to handle TB?
So tuberculosis currently, one could consider it an age-old disease.
Right.
And we have learned many lessons since we began fighting TB.
Yes.
Tuberculosis at its peak was killing a lot of people. It was actually called the White Plague in Europe at that time. It was the #1 killer of people as Europe was developing.
Yes.
Today, tuberculosis hardly kills people in those parts of the world. However, if you look at the global picture, tuberculosis affects nearly 10 million people every year and kills about 1.5 million people every year.
Wow.
Most of those people are currently in low and middle income countries, and within low and middle income countries, the disease affects primarily those in the poor sectors of society. So it's a disease of the poor. It's also a disease of people with compromised immune functions. So if you're HIV infected, if you're diabetic, you've got chronic kidney disease, any of those conditions can increase your risk of getting tuberculosis disease and dying from it.
Right.
We have over the years developed what one would call strategies for controlling TB. In 1993, the World Health Organization declared tuberculosis a global emergency, just like it did recently with COVID-19. And we started with a strategy that was called the DOT strategy.
Yes.
And then we moved on to what was called the Stop TB strategy. And now we have moved on to what is called the End TB strategy. The game plan has changed. The idea here is that now we want to end tuberculosis as a public health threat. By 2030, 2035, we would want tuberculosis not to be the #1 killer of people from a single infectious pathogen.
Yeah, but you've mentioned those strategies. Could you break them down for us?
So the first and very important thing is to have a good political commitment to fight tuberculosis.
Yes.
We have seen that with COVID. Every single president, prime minister has spoken about COVID and outlined what countries will do about COVID. We want to see the same kind of thing continue to happen for TB.
Okay.
We believe, some of us, that COVID will pass. It might, at the end of the day, pass with a lot of people. It might take a lot of people with it as
Already
it goes away.
yeah.
It is doing that, and it probably might do more damage, but it will pass. And then we might be left with tuberculosis going on, silently killing people out there. And therefore, we would want to see better political commitment, better political coordination.
Right.
We would want to see more resources mobilized for tuberculosis. We would like to see health systems strengthened to be able to fight tuberculosis. We would like to see the private sector involved in the fight against tuberculosis.
Right.
We want to see new drugs and new diagnostics, and maybe eventually a vaccine against tuberculosis.
Yes. Now, I'm curious about your take on this. He has pointed out that tuberculosis basically turned out to be a disease of the poor. Now, how did this affect how quick we could handle it over the years, and how could this also reflect on how we are handling COVID-19?
Yes, there are a lot of delays in the system, so that really comes in, and both the two diseases require early diagnosis.
Right.
That you make a diagnosis as fast as possible.
Sure.
Once somebody is identified, you isolate so that they don't spread. And for those who have the disease, you also look for contacts, and those are what the tuberculosis all have been doing, what you call contact tracing. Okay. So you have to look for those who probably were exposed, and then screen them.
Yes.
Those who are symptomatic, subject them to diagnostic apparatus, and if they are diagnosed, isolate and manage. So contact tracing has been one of the lessons that tuberculosis brings on board. The second part of it is the engagement of the community.
Yes.
And I think communities get engaged both in terms of getting the right information and knowing the signs and the symptoms and where to get services.
Yes.
Some of these community actors can also participate in identifying events and potential cases, right, and referring them to the authorities. Putting resources is key, but also making sure that as many actors come in, a proper coordination. So as I think, when I was coming in, I was hearing certain segment of the population feeling like they are not involved,
yes,
like the deaf.
The deaf, yeah.
So really to make sure that we have proper community engagement, that if it's a communication, it reaches the youth. Right. The youth is a unique group. Some of them don't think even that the risk is the disease for the elderly. So making sure that everybody understands that everybody is at a risk, and you have to take action. There are informal settlements. We are talking about social distancing, we are talking about isolation. You are in one room. We are talking about access to basic sanitation and hygiene, what is an issue. So those conversations around how do we work with the existing networks, yes, to really appreciate when we say we are deploying interventions, does it speak to this, is it speaking to that context?
Right.
Yes.
And Dr. Jeremiah, if we're being realistic, when you look at some of these urban settlements even, there's a lot of difficulty in trying to contain, whether you're talking about TB or COVID-19. You cannot tell a family that lives in a shanty, you know, to step out, or even that 100 meters literally might be the entire room. So what has been applied to the handling of TB that could be applied to the fight against COVID-19 when we're looking at these two conditions and trying to figure out how we can actually help certain communities deal with it?
Like Dr. Langati has said, the key thing really is to identify people who are sick with the disease early, because these are the transmitters. And even today, if you look at how the epidemic has been, the COVID-19 epidemic, for example, has spread around in the places that are highly affected. Nearly a third or more of those infections are household infections. Right. And then another third are probably close contacts at workplaces and social places and that kind of thing. And that's why the measures that we know have been taken, closure of schools, bars, pubs, and stuff like that. But it all begins with being able to test people. Yes. And once you have identified someone who has either COVID or TB, screening everyone around that individual. Right. And you start with a smaller group of people that are in the same household with that individual or in the same workplace, and you can expand your screening to a wider population. Okay. That's the way we've done it with TB over many years, and successfully so. And I think that is the way things will go with COVID-19 too. And there are similarities there, and I think those Many of us are involved both in the fight against TB, and now we will be involved with the fight against COVID, because there's a lot of similarities between these two diseases in terms of transmission dynamics.
Now, Dr. Langat, tracing down people who have possibly been in contact, I can imagine for TB, this was a challenge. Right now, we are facing perhaps around 646 people who could have possibly been in contact with the people who are already infected by the coronavirus. So what would be the headache if you're trying to trace each and every single person, keeping in mind that they also have possibly interacted with other people?
Yeah, it's a challenge.
Yes.
One, first of all, is even to locate where they are,
Yeah.
you know, to have the phone numbers, you know, their physical address.
Yeah.
I think that is the starting point. Anybody doing contact tracing must really be able to document where all these people are, and then some might be out of the vicinity, so networking with other actors. You know, maybe your contact has moved to Mombasa, so how do you link up with the county government and the committees within those counties to facilitate contact tracing?
Yeah.
Sometimes even I come to your house and you don't want me to access your house, so there's a lot of people might fight back. The fact that you are coming in masks is also stigmatizing me, so you are branding me in the whole community. That, so there is that element of the community seeing you as a risk to the whole society.
Right.
So I think we really have to manage both the repercussion in terms of what the community is ascribing to somebody with a potential suspect for COVID, and also making sure that as you also do this contact tracing, protecting the healthcare workers. So it's a bit of, there's no simple way of doing it, but I think for us, we are appealing that these are human beings. Any of us can get infected, and therefore we should accept.
Right.
And be willing to work with them, be willing to even talk to them, whether it's through phone calls and whatnot. Just empathize, maintain conversation with them. It's not that they are in different circumstances, that's why they got exposed. So contact tracing is not easy. And even in tuberculosis, we don't always get all the contacts.
Right.
I think we perform sometime. We expect in an household maybe 4 contacts on average, and if we look at the program we are running right now, sometimes you only get 1 or 2. Okay. The rest are out of reach. Yes.
And would you say that there's always that perception that it can't be me? I mean, people always see it as someone else's problem. Could this be part of the problem, Dr. Jakaya?
It is always the problem. It is that's the reason that a lot of us do not take health actions, because it's always the other guy, not me.
Not me.
And that's a difficult situation to deal with. But I think in Kenya we will have, and we do have, a very peculiar problem at this moment in time, in relation to COVID-19 specifically, in that people are caught between a rock and a very hard surface.
Sure.
Do you go out, earn a living, and risk getting coronavirus and bringing it home to your family, or do you stay at home and remain hungry? In places where economies are stronger and governments have a little more revenue, there are social support systems that can be mobilized to support people to be able to live and sustain themselves as we wait for this wave of this epidemic to go over. We can't do that. I mean, I've just heard those figures that were being mentioned by the economist before our show, and they are shocking figures.
For sure.
So in that respect, COVID is relatively different to TB. Although there are also major economic costs for TB, and those economic costs are related primarily to deaths by young adults. Tuberculosis in our region, in most parts of the world, affects mainly younger people, the so-called productive age group. And so it has its economic costs. It's a developmental issue because of that kind of thing. COVID, on the other hand, has affected mainly, at least in those parts where we've seen figures, mainly elderly populations. And the cost there is really related to the provision of care to a very large number of people that overwhelm very easily the healthcare system. So they all will have, and the fact that we are shutting down countries and what have you to try and stem the spread of this virus. So the economic cost for both diseases, the economic cost for COVID immediate, urgent, quick, while the economic cost for tuberculosis may be slow, but prolonged over a very long period of time.
But obviously this is, it means that when we are talking about prevention, we're not just doing it for ourselves, like, you know, in TB, you don't want to catch it yourself. With COVID-19, you might catch it, survive, but then pass it on to someone who's more vulnerable. What would you say about that?
That's exactly the same thing with TB. These infectious diseases are literally more or less the same. I don't want to catch COVID, neither do I want to catch TB. But once I catch TB, I could pass it on to my family, to my workmates, to people that I socialize with. It's the same with COVID.
Equally,
It's the same. I don't want to catch it, and if I catch it, and especially the difference here is that potentially, COVID can be transmitted to people before symptoms show up.
That's it.
Potentially. Tuberculosis hardly transmits, although we are also learning new things about transmission of TB. But TB will not transmit until I get symptoms. So it's when I'm coughing, it's when I am having problem in my lung and I'm coughing that I transmit COVID. I transmit TB. While for COVID, before I develop symptoms, I could already be transmitting.
While I'm looking fit and okay and thinking I'm fine, I'm spreading it probably. Right, so that calls for a lot of community awareness, and I'd like to get into that on the other side of this break. We'll look at how the community can be marshaled to help prevent this, and obviously how knowledge can help us actually deal with this, because it has worked in many instances with tuberculosis. Let's take that short break. When we come back, we'll have more for you right here on Morning Express.